I welcome you for the discussion on public-private partnership, which is a vital aspect of modern infrastructure development. I am Dr. Santhakumari, Assistant Professor from the Department of Public Health Dentistry, VMSDC. Public-private partnerships are not merely alliances, but collaborations between the public and private sectors. They are avenues for revolutionizing healthcare system, particularly in countries like India, where the demand for quality healthcare is increasing. Public-private partnerships entail a cooperative arrangement between government entities and private sector organizations for finance, for development, for cooperation and to maintain public infrastructure and to provide public services. According to World Health Organization, public-private partnership is described as convergence of minds coming together of various stakeholders united by a singular purpose is enhancement of population health. In this lecture, we could understand how the public-private partnerships transform and reshape the landscape of healthcare delivery. Let's see the mechanism behind this collaboration. Basically, public-private partnership is a symbiotic relationship in which the public sector includes organizations that are financed by state revenue. It functions under the government budget or government control, whereas the private sector comprises of organizations and individuals working outside the direct control of the state. To understand this, the distribution of vaccines during COVID-19 was a prime example. During COVID pandemic, private companies manufactured vaccines while the government was making vaccines available to the people at concessional rates. So, the public sector funded by state or the central revenue collaborates with the private sector, which is operated independently from government control, is called a public-private partnership. Though they are independent, each sector brings unique strength to the partnership. In public-private partnership, the roles are well defined. The public sector government provides essential funding for healthcare services, especially for the underprivileged. Meanwhile, the private sector builds healthcare facilities which is best in class with the best resources. At the same time, it needs to see sustainable profitability for its efforts. Thus, public-private partnership offer a unique opportunity to leverage the strengths of both sectors for the benefit of society. Now, let's see the key features of public-private partnership. One of the key features of public-private partnership is the sharing of risk, responsibility and rewards between these two sectors. For example, when a private organization accepts for constructing a hospital with the help of state revenue, both the parties share the risk associated with the project, such as delays in construction, cost overruns and revenue fluctuations. Next feature is innovation. Through public-private partnerships, government can tap the private sector expertise and innovation to deliver better services to citizens. Next feature is efficiency. Efficiency and innovation are the core feature for successful public-private partnership projects. This feature will increase the economic growth and development of a country. Also, public-private partnerships can enhance the project delivery timelines and optimize the resource allocation. Finally, the lifestyle approach, which means public-private partnerships typically involve the private sector in the project's entire life cycle, right from the planning and designing to the financing, construction, operation and maintenance. Thus, this feature of integration maintains a commitment throughout the life cycle of the project. Now, we will see some public-private partnerships in India. Several public-private partnership initiatives in healthcare have been implemented in India. Some of them are Yashaswini Cooperative Farmers Healthcare Scheme, Arogya Raksha Scheme in Andhra Pradesh, the Uttaranchal Mobile Hospital and Research Center. Next one is an Emergency Ambulance Services Scheme in Tamil Nadu, Telemedicine Initiative by Narayana Hrudalaya in Karnataka. Now, let's see this real-world example. First one is Yashaswini Cooperative Farmers Healthcare Scheme. It is a micro-insurance scheme in Karnataka that provides medical insurance to low and middle income cooperative members. The scheme was launched in 2003 to improve healthcare facilities and economic well-being of farmers. This scheme is the partnership between Narayana Hrudalaya, a private hospital in Bangalore, and the Department of Cooperatives of Karnataka government. Here, the government of Karnataka contribute to the scheme. and the Department of Cooperation sets the enrollment and renewal guidelines. The members of this scheme pay a monthly premium to avail free treatment in 160 hospitals located in all districts of Karnataka for the medical procedures up to 2 lakhs. A quarter of that premium is paid by the government. Next is Arogya Raksha scheme in Andhra Pradesh. This was initiated by the government of Andhra Pradesh in collaboration with the New India Assurance Company and with the private clinics. It is an insurance scheme fully funded by the government which provides hospitalization and personal accident benefits to citizens who are below poverty line and who undergo family planning from government health institutions. The next initiative which works under the principle of public-private partnership is Uttaranchal Mobile Hospital and Research Center. It is a three-way partnership between the government of Uttaranchal, the TIFAC, which is an autonomous organization under the Department of Science and Technology, and the BISR, that is the Birla Institute of Scientific Research. They provide healthcare and diagnostic facilities to poor and rural people at their doorstep, specifically for the people who live in difficult hilly terrain areas. The next scheme is Emergency Ambulance Service Scheme in Tamil Nadu. This initiative was started in Theni district of Tamil Nadu state in 2008. It focuses on maternal health. As per the statistics, the major cause of maternal mortality is because of inadequate transport facilities for pregnant women. To solve this problem, Government of Tamil Nadu initiated an emergency ambulance service scheme to reduce the maternal mortality rate. The Government of Tamil Nadu tied up with the private organization called Seva Nilayam. Here, the partnership works in such a way that the government supplies the vehicles and the Seva Nilayam, which is a private organization, operates the program through user charges. So, moving on to the next scheme is Telemedicine Initiative by Narayana Hrudalaya in Karnataka. The government of Karnataka initiated telemedicine project called Karnataka Integrated Telemedicine and Telehealth Project in association with Narayana Hrudalaya Hospital, Bangalore, and with the ISRO, that is the Indian Space Research Organization. Actually, it provides a specialty care for the unserved and the underserved people, and thereby it reduces both the time and cost burden of the people. So, this initiative improved the quality of healthcare through timely diagnosis and treatment. Apart from these examples, there are numerous schemes being envisaged to provide a robust healthcare framework in the country. Now, let's explore the multitude benefits of public-private partnerships. They are improved infrastructure development, enhanced service quality, risk transfer, and innovative financing. Through improved infrastructure development, a partnership can facilitate a development of infrastructure projects that might otherwise be delayed or unfeasible due to budgetary constraints. Next benefit is through competition and performance-based contracts, public-private partnerships can improve the quality and efficiency of public services. Coming to the risk transfer, public-private partnerships allow the transfer of certain project risks such as construction, operational risk to the private sector. Thereby, it reduces the burden on the public sector. Another benefit is innovative financing, which will diversify the funding resources for different public projects. So, these are considered to be the advantages of public-private partnerships. Now, moving on to the requirements for a successful public-private partnership. To achieve this, certain prerequisites must be met. Primarily, a clear understanding of responsibilities and obligations between the partners is very, very essential. Partnerships works typically with one providing the financing and the other providing the service. So, this point should be very clear. Also, there is a need for some catalyst to start the process of partnership. That catalyst could be an individual, a donor, a compelling vision, or even a political or economic crisis. Next requirement is the robust community support under conducive political and legal environment, which is also very, very essential. Additionally, well-defined regulatory framework, strong management information system, and clarity on incentives are vital for a successful partnership. While public-private partnerships offer significant benefits, they also come with challenges such as risk allocation, complexity, long-term commitment, and public scrutiny. When we talk about the complexity challenge, public-private partnerships involves an intricate contractual arrangements and regulatory frameworks which will increase the project complexity and administrative burden. Next one is the risk allocation between the public and private sectors can be a challenging one, and sometimes that may lead to disputes. To avoid this, transparency and accountability is essential. Next challenge is public opposition. Some of the partnerships have faced n number of criticism over privatization, transparency and accountability, which leads to public opposition in some cases. Lastly, the long-term commitment. If there is any changes in such a cases, like in political or economic condition changes that may impact the project viability, in such cases public-private partnerships require a long-term commitments from both the parties. So these are the common challenges frequently faced in public-private partnerships. Now we will see the health sector reforms in public-private partnership. It is widely accepted that there exists deficiency in public health system. This can only be overcome by significant reforms, although health sector reforms can be in the form of alternative financing, autonomy to hospitals, civil service, capacity building, etc. But in reality, neither the public sector nor the private sector alone can operate the best health system. So both the sectors has to work in balanced frequency. If this innovative collaboration between public and private sectors works, it has got a significant potential for economic growth, also helps to foster innovation and would improve the quality of public services. Coming to the public health significance, a healthcare system in India can be improved in concern with public-private partnership, as some of major sectors like telecom, irrigation, electricity, airports have witnessed the success of public-private partnership. This type of partnership, if executed in healthcare sector, can also benefit for the same. Public-private partnership in healthcare would lead to increased accessibility and availability of healthcare services, particularly in rural India. Also, it will improve the primary healthcare services because most of the private sector focuses on providing secondary and tertiary care, whereas the primary healthcare sector remains an untapped area. So this type of partnership would improve the primary healthcare facilities. Next one is the increase the quality of services. As public-private partnership works on performance-based standards and contractual accountability, it focuses on providing high quality services and improves the patient satisfaction. In conclusion, as we witness the evolution of healthcare delivery system through the public-private partnership, it is evident that these partnerships are not just collaboration, they are catalyst for change. They hold the promise of a future where healthcare is not just a privilege but a fundamental right accessible to all irrespective of socio-economic status. Thank you.